This is Dr. Saima, consultant ENT from Jammu. Today, I'll be discussing a very rare case and an interesting case of nasal lobular capillary hemangioma. So, as you can see, I have exposed the anterior part of the nasal cavity by just lifting the tip of the nose. A smooth surface, shiny reddish mass is seen in left nasal cavity. We can see here. And most of the students watching this video will consider this as inferior turbinate hypertrophy. But there's a particular method to differentiate any mass lesion with inferior turbinate hypertrophy, for which what you have to do is you have to decongest the area with adrenaline solution, and within few minutes you can see the hypertrophied inferior turbinate will come back to its normal size. Whereas if it's normal mass or any vascular lesion or polyp, it will not regress in size. So that is the basic concept. Well, coming back to this particular patient, she is a middle-aged female with only complaints of left recurrent epistaxis. There was no major obstruction, no facial pain, no facial edema, there was no snoring and mouth breathing. I did a preliminary scan where you can see that there's a opacity in the inferior part of the nasal septum here, and behind that we can see a septal spur which is of grade 1, and there was adequate airway. On the right side we can see concha bullosa also. So with the standard protocol, I did one anterior rhinoscopy, and initially the lesion was very small, arising from the midline, that is nasal septum, and it was congested all over with crusting on the apex because of exposure to the dry air. Post that, I did for proper diagnosis, I did nasoendoscopy and could find septal spur, as I already mentioned. So on clinical examination, I immediately assumed that this could be a case of nasal vascular mass. And the treatment of choice for such condition is complete excision. It was completely excised with the help of bipolar cautery, and it was sent for histopathological examination. The cauterization was done till the perichondrium to prevent the recurrence. The histopathological examination reveals capillary hemangioma. So, let me quickly summarize some important points about capillary lobular hemangioma, that it can occur at any age but most commonly seen in the third decade of life. It's benign in nature, it's rapidly growing tumor, the size varies from few millimeter to few centimeter. It arises from the midline, specifically from the anterior-inferior part of the nasal septum in its little's area because of its vascular prominence. It can be stalked or broad-based. Its counterpart, cavernous hemangioma, is commonly seen in the lateral wall of nose, and you can see the calcium deposit in it. So that's all. This is how you deal with cavernous hemangioma. Thank you very much.